We'll call this meeting to order at 8:32. Good morning, everybody.
Good morning.
Roll call. I believe everyone is here. The approval of the agenda. Do I have an approval? Virginia?
I'll make the motion to approve the agenda.
Do I have a second?
I'll second.
Milty? All in favor say yes.
Aye.
Yes.
All opposed? Do we have any discussion on the agenda about it? Talk into it. Maybe I should talk into it. Do we have any discussion with the agenda or anything before we move on? Then I'll have an approval of the June minutes.
I have two corrections.
Yes.
This is in the paragraph, the health department works side by side, and it's a question arose concerning heart services and the controversy. It should be controversy. So it's kind of a misspelled word. It should be CONTROVERSY. Do you know where I am, Deanne?
I'm looking too. I can't
Okay,
find it.
It's actually on the second page, and it's, on my page, it's like 2/3 of the way down, 3/4 of the way down. It's the sentence, a question arose concerning hard surfaces.
And what was, you had,
The word should be controversy, not controversy. And then the second one is missing a word is. This is in the paragraph concerning meetings with Cindy, and it said that she the treasurer. It should be she is the treasurer. That's on the next page, again, about 2/3 of the way down.
oh yeah. Is that it, Virginia or Julie?
That's it.
Okay.
Yes.
Do you have it, Deanne? You're good. Is there anything else? Then I'm going to go back here. Then do I have an approval of the June minutes? A motion? Milty,
I so move to approve the June minutes.
do I have a second? Kathy, all in favor, say aye.
Aye.
All opposed? Do we have any citizen input? So we'll move to the COVID update, Cindy.
Okay. So if you've been watching the numbers, they've been steadily going up in Kewaunee County. I was trying to gather some numbers this morning. So we're currently at this moment at least 78 in the county. So we've jumped 10 since last Thursday with the last update that went out. So they're going up. I can't tell you that it's one age group by any means. It's across the board. So we've seen a spike in the 20s. That group has had a fair number of increases, but we've seen just as much go up in the 40s, the 50s, the 60s. I've had some 70s. So it's across the board with that. The majority of our cases are not terribly sick. A lot of them are either asymptomatic or having minor symptoms such as loss of taste or smell, some minor cough, congestion things, but no one currently is hospitalized to my knowledge on that. Other than that, we do have a clinic now that, 2 clinics that are testing. So I believe that you can call Door County Memorial Clinic in Algoma, and also Bellin here in Kewaunee is offering local testing. It is by appointment only, and it is only on certain days of the week that they're doing that. But we are seeing more local testing start. We're hoping to have all of our clinics, hopefully in the future, do that. That's part of what we're going to do some outreach on. Very possibly, yes. Right. No, the problem with the local testing is that they don't want to bring people with COVID into the buildings because it just puts everyone else at that much greater risk. So, yeah, the 10 would be for that. Yeah.
Cindy, on the 78 cases that were positive,
Yep.
Were these people going in because they were sick? You're saying they're asymptomatic, so why were they tested in the first
Some
place?
of them are asymptomatic and were contacts of others. Some of them are sick.
Okay.
Yeah.
And then regarding antibody testing, is that something that we're doing much of either locally or statewide?
You're starting to see the numbers of antibody tests increase. They are antibody testing positive cases afterwards to make sure that they are carrying the antibodies necessary after their infection. But to receive an antibody test right now, you need a doctor's order. So it's not something like our normal testing where you can say, oh, I want this done, and therefore you can go into a drive-through community site. This actually needs a physician order from your personal physician to do it. So not as much antibody testing going on right now.
After a person is, after they test positive, in order to be declared clear or no longer active, is it required for them to be retested, or is it just that they have no symptoms for a period of time?
Correct.
And what is the shortest amount of time?
Well, people who test positive have to remain in quarantine for 10 days from the start of their symptoms, and they have to be found 3 days free of symptoms at the end. So if the last 3 days of their 10-day quarantine, they're symptom-free, they can get released. If they are not symptom-free, that quarantine carries on until they are symptom-free for 3 days. For people who are asymptomatic, they can't obviously use the date of symptom start, so then it goes by the date of testing.
And what's the amount of time?
Same thing for them, 10 days and 3 days free of symptoms.
So from the date of testing,
Correct.
they would need to be 10 days before they were no longer in quarantine.
Correct. Unfortunately for their contacts, if you test positive, it's a much worse scenario because you need to remain in quarantine for 14 days from the positive person's last symptoms.
Okay.
So their first day symptom free, then you can start your 14-day quarantine. So you may be home in excess of 3 weeks.
So a person, but just to be clear, a person who is asymptomatic, they test positive 10 days.
Correct.
That they are to be quarantined.
Because they're a carrier of that. And it's been found through studies that it takes at least that period of time for them not to be shedding that virus.
Thank you.
Cindy, had some of these recent people that were positive, had they attended big gatherings or?
We've seen a little bit of everything. So we have seen some that spent time in bars in Brown County. We had some that spent time in bars in Denmark, had a significant outbreak in their bars. We had a Denmark baseball team that tested positive, so therefore some of them were affected by that because they're doing baseball tournaments. We've had people that have tested positive at work and their work site. We've had people who have been working from home literally for 3.5 months and tested positive, and they have no idea why. So it could have just been basic community spread, grocery store, going out, whether that be church or a bank or wherever they might be going into that had a group of people.
But the key is what you first said in the opening statement was that no one is hospitalized, and it's been very light symptoms.
In this
here.
county right now, yes. We have symptomatic people, and we have some people who are quite sick, but they're not sick enough to be hospitalized. Mm-hmm. The death of COVID. Yep. So deaths of COVID typically are hospitalized individuals, and they've tested positive. And once you're hospitalized, so in an ICU or whatever that situation might be, those people need 2 negative tests to clear. So if they are hospitalized with COVID and they remain hospitalized and they have 2 negative tests, they would no longer be deemed a COVID death if they died after that point. But if they're admitted in, found positive, and pass away while they're positive and haven't had that chance to clear, then they would be listed as a positive COVID death.
There's been so many in nursing homes and
Correct. So those people have tested positive. Yep. In hospitals, nursing homes, those kind of places, once you test, if you're in a facility, yes. Because most times, if you are not hospitalized with COVID, it's not that you can't die at home with it, but um, if you were sick enough from it, you would have gone into a facility. So the deaths that they see are usually people that are inpatient.
How is it monitored? I mean, the quarantining. I mean, when a person tests positive, is there any monitoring of that, or is it
That's
just
what the health department does with contact tracing. So that's why we call them on a daily basis, and that's why contact tracing is so intensive, because you're in constant contact with those people
So you call them on a daily basis to verify that they are quarantining?
and that
during
their
the-
symptoms have not changed. Correct. And then you also have to call their contacts.
Okay.
So you may have 78 positive cases. Right now, I can't tell you what our active count is. It's probably about 18 positives that we're actively following right now, but we're following those 18, plus we're following every person they've been in contact with within 6 feet for an extended period of time, up to, at least a minimum of 10 minutes.
I'm going to ask the question about schools.
Mhm.
We brought it up last month, and what's going on there?
So our schools have plans in place. Algoma released their plan. I saw it online last night, actually. And Luxembourg Casco is actively working on theirs. We have a meeting this Thursday with them. Kewaunee is actively working on theirs as well. The plan is that the schools will open in fall. And they basically have worked together on a pandemic plan. So their nurses have come together and some of their staff, and it's relatively the same plan for all 3 districts with a few tweaks to make it work independently for each one, because they are so different in size and just different aspects within what they do. But for the most part, they are all moving forward.
I had a question brought up. So Luxembourg opens up their school right now for weight room. I believe it's volleyball. And it's from, I think, 6 to 1, one of the parents said. But Algoma and Kewaunee, 2 parents that one was from Algoma, one was from Kewaunee, and one was from Luxembourg. All have kids that are in sports. And Algoma and Kewaunee haven't done so. And I was just wondering.
It's an individual decision based on the district. So, they can choose. The Luxembourg Casco, I've sat at a lot of their meetings, is working pretty tightly with Bellin on reopening.
Okay.
They have people in place to monitor the weight room, to clean after each person uses the equipment. Excuse me. So they've put their plans in place. Some districts may not feel that they have the staff to do that right now, so it's just individualized. I know Luxembourg Casco has restarted a few of their sports back up for the summer, so they waited till July to do that. Some districts have chosen not to do that.
Okay.
And part of that conversation was also on transportation and busing, which has been a really big issue. So I know for the summer, it was encouraged that students get transported via their family or their individual car right now, if they can do that, to do some of that summer stuff, versus running busing at this time, because busing has been a big dilemma.
Any other questions? Okay, then we'll move to, is there anything else, Cindy, that you have?
I have other things later, but not on that. Yep.
Okay.
Yep.
So now we'll move to the ordinance discussion. This is on the ordinance that was brought up last month. I had it put back on. And the reason I did is because I said I was going to table it. I was going to talk to Jeff. I was going to look more into it. And I did so. I did talk to Jeff. And Linda, you had brought it up last time. The ordinance that we had placed as a county board, we had agreed on it back in March, I believe we voted on it. And after that, I had received some phone calls and texts from other counties asking about the same ordinance, and it was worded about the same way. And then there was a lot of, I want to say, flags that were drawn on it, and it bothered me because I feel as a county, we already had put an ordinance together back in March. And it worked as a team. It worked with whatever committee we needed to pull in, the supervisor, which at the time was Bob, our executive, and our administrative. And we can come up with a game plan. So it bothered me a little bit that this ordinance was brought forward and it wasn't involving all of us. And the reason I say that is because when I was voted in as a supervisor, I was voted in from the people, just like all of us. So I feel that us 20 people should be involved in the ordinance, which we are, and the one that we did for the county board. And I think that one's working just fine. And at this time, I feel that this ordinance, I would just like to, get rid of it, reject it, because we have an ordinance, and that ordinance involves all of us as team members. And I think that's what we need to focus on, is when there is an issue, an emergency action plan, we bring in the chair, we bring in the executive, we bring in the administrator, we bring in whatever committee we need to bring in and to discuss it as a team, because that is how we were voted, as from the public. Each of us represents our district, and we need to be working together as a team and not separately. And I feel that the ordinance we have in place already is doing that. And I wanted to bring it to the table because I think that also, like I said, there were a lot of, if this wasn't a big deal, I don't think I should have been receiving some of the phone calls I was receiving and some of the stuff that's going on in our state about this ordinance. And I don't want to get involved in something that maybe has some bad apples in it. And I think Kewaunee County is pretty unique, and I think we have some outstanding people that work in our county, and we have some outstanding supervisors, and I think we're pretty smart when it comes to something pretty major that we can work together as a team and come up with any emergency action plan, and we already have it in place. So at this time, I would like to see if, or I would like to see that this is rejected, and put away in that we already have our implemented ordinance plan in place, and we have used it, and I think it has worked very well. Plus, having two ordinances, is it not confusing to the people? It's confusing to me, because that one already implements everything in place. It puts it all together. Those are the people that need to discuss it. So that is just my thought on it.
The other one was a resolution. This is.
Right, I'm sorry, resolution. It's resolution, sorry. I meant when it was in the process, yes, then it got voted through as a resolution. But it worked. And we know it worked because we used it. And it included all of us. And I'm just speaking, as I said, when I got voted in, I got voted on my district from people. And we need to think about our county. So all of us have to work together as a team. Because I know there was quite a few people in our county that said, what is going on here? Like, why are some people included and not some? I feel it's teamwork. And that's what makes us so unique, is working together as a team to implement something. So if there's any other questions about it or discussion, otherwise I would like to move forward on rejecting this ordinance. If I have a motion.
I'll make that motion.
Do I have a second? Milty?
I'll second the motion.
All in favor by saying aye.
Aye.
All opposed? So we're going to move to the next agenda, which is the budget adjustments, the updates.
I just wanted to make you all aware that we have gotten some additional funding. I think I mentioned that it was coming down the pike last month, and we have gotten some. So we have gotten roughly $55,000 in regard to testing. So we're going to be looking at possibly working with some of our more at-risk populations to offer testing. That might be our nursing homes, our CBRFs, our group homes, those kind of facilities, adult day facilities, that kind of thing, to assure that testing is available to them if they would choose to want that or need that for a reason. We've also gotten a fair amount of money for contact tracing. The contact tracing is based on the amount that we bill for it. So with contact tracing, we're never going to use the amount probably that they gave us. It was like in excess of, do you remember the exact amount? Yeah, $176,000, and I don't think that will come near that in this county. But we are doing a lot more. We've started with a couple new employees that are helping us in that area. So, and not totally new. Jessica was a part-time employee in our office. We've increased her to full-time to do contact tracing for us. Some of Rachel Bauer's open hours that were used under county tax levy dollars will be based on contact tracing because she's doing contact tracing for us. And then we've taken on a college student for a few weeks this summer who is going to help us with some of that contact tracing as well. And then once she's gone, we're looking at having another person in place that will just step in so that we can use some of that money for that.
Can I ask about that money? So at the county board meeting, it was Scott who said that the county was receiving money. So now your department receives money from the COVID, correct? And this is what your
It's two different pots of money. So what the county's getting
is
is their
separate, and now
recovery.
your pot
Yep,
is
correct.
So with your pot, is it directly that you have to use within the health department, or can okay?
Yes.
You can't like go to like the schools or anything like that
No.
and use it.
No.
Like,
And the
you know,
schools
because
have
it-
received their
their
own
own
pot.
pot.
Yep.
Okay.
So they're all getting their individual pots of money, our money. So we got the contact tracing and the testing. We have some that it falls under the category of epidemiology right now. That was about 13,000 that came through, and that's the one we're not touching at this time because it carries out the longest out of all the pots of money. Contact tracing is only being given to us till the end of the year. So that's why I said 176,000 won't be spent by our small
Right.
health department prior to that. And the testing is through the end of the year as well. Epidemiology carries out right now. It was listed as September, and we also received through FEP, which is Homeland Security, and that's where we get our preparedness money. They gave us an equal amount to our preparedness for COVID specific.
Okay.
So that money carries out till March. So they all have different timelines, but that money, we had a little bit more leeway on what we could spend. So for instance, we upgraded our vaccine refrigerator because we know that we're going to need a bigger vaccine refrigerator than what we had when vaccine for COVID becomes available, things like that. And we're buying supplies in preparation for those kind of things. But no, all of the money that comes to the health department has to be used specifically for the health department. We were able to buy like the hand sanitizing stations that you see in each of the buildings. That was purchased through that money.
Okay.
We are buying hand sanitizing, I don't know what they're called, the wall hanging ones for each of the parks right now. So that bill will be coming to us. So some of those things that we can justify through the public health money, we're doing through that. Yeah, for the
Now,
county.
I have another question. So like your PPE, that was money that was given out to people. Well, now we're finding out that people are somehow, it's going to be taken off of something that they're going to have to pay for it back in certain ways. So my question is, with the health department receiving all this free money, because Aaron Augustine made that comment to Scott, I believe the county's supposed to receive $373,000. Well, we've been noticing the PPE somewhere along the line, it's not just free money. There is a catch, and it's going to be paid back in some means, a certain amount of it. An example is any farmers that received a PPE, a business, whatever your amount that you're going to be getting for milk, they're taking so much off because you receive PPE. So if you have let's just say it's $20 for every 100 milk, because you had PPE, it's being $5 is coming off of that. So instead of 20, you're only going to be getting 15. So that's my question is there any catches? Because we are finding that out now. Anyone that applied for PPE, same thing with my husband, in any restaurants or that, they're noticing little restrictions that are coming back where they will have to pay some of this back. So is that where could that happen where they would come back and say, well, you know, we gave you this as a health department. Next year, you're not going to receive it in certain maybe other grants that they're going to.
At this time, I'm not aware of that. In fact, I think they've done the opposite for us, where right now our current grants, and I'll use prevention as an example, our prevention dollars go through September of this year. We were told already in March, we know that you're in a crisis. Use whatever money you need from prevention to get the work done that you need to do with COVID. And so we're not being penalized with that. That's the first I've heard of that, because with the public health dollars, we have not been told that.
I would think that it would become less restrictive. I know like on the PPP, the Payroll Protection Program, they've scaled back some of those restrictions and whatnot on the smaller amounts.
Yep.
But when you're taking on any assistance, I don't believe they can become more restrictive on the requirements once you've agreed to take it on those initial terms. So.
Right. Yeah, we had received some emails. So, and that's why Aaron brought it up at the county board with the PPE to Scott, saying
So when you say PPE, like what are you getting?
payment protection plan that businesses.
So PPP.
I'm sorry, PP.
Okay,
yes.
because PPE is like they're
Yes.
penalizing you
No,
for masks
sorry.
and gloves
No.
and things like that. That's right.
No, I meant PPP, payment protection plan.
Okay.
And that plan now being implemented, we've been finding out that there's little catches where this is going to come off of this or whatever. So I'm just saying, when they say free, I hope there's no fine print that, you know, a couple months down the road, there's a little restriction because we got something for free and then we have to somehow pay it back. And I've noticed it. My husband has noticed it with some of the businesses that he's talking to where they applied for it and got it. We've noticed it from the emails in the farming industry. So it's out there. But I mean, it helps you through the tough times. But now when times are increasing, you're getting a little bit off to pay for what you. So I was just curious if they had anything attached to that.
No, not through what I'm receiving.
I know Scott made a comment at the county board that he had questioned it himself and was looking into it. So is there anything else, Cindy? Because I kind of interrupted.
No, budget-wise, I think that's it. So I think just going forward, I haven't done a resolution yet on all of the budget changes because we're still finding out some of those as this money is getting finalized right now. So I'm hoping that by like September 1st, I can have a resolution with all of the different changes that we're receiving. But it's just they've been shifting things left and right now. So I haven't done it yet because Jeff usually writes it up all in one for us.
Okay. Anything else? Or any questions? Okay, so then we'll move to, was that with the report, Cindy, or?
That isn't. So you have your monthly report in front of you. Any questions on anything? I can go through a few things. So our WIC contract caseload has been holding its own at 215. That's where we've been averaging about 208 active cases a month there. Our services are starting to pick up. We are seeing more and more people call for services again. We're one of the few counties that is actually opening our doors to vaccinations and TB skin testing. Most neighboring counties have not done that yet. So we're doing it by appointment only at this point. I wanted to point out the communicable diseases. So you see the number reported was 860. I think I told you this last month, but we average 189 to 90 a year, and that was 860 in 1 month that came in. So the staff is incredibly busy going through each report that we receive, whether it's a confirmed positive case or whether it's a negative case, we still have to do an investigation on all of those and go through them. So it's time consuming. So they've been very busy with that.
Is there a particular disease that is seen through this? Or, I mean, last month was 760, we're at 1,500.
This is all COVID. So this is
So that's
primarily all COVID. I knew someone would ask me that. So we had 19 confirmed cases last month of COVID-19 and 830 that were not a case, but you still have to do the work on all of those. Other than that, we had 6 other cases of various diseases from chlamydia to Lyme's disease, crypto. So we've had a little bit of everything. We had a histoplasmosis in there. So we're seeing other things slowly come in, but really our regular diseases have just kind of dropped off because of people staying at home more and doing more things at home. So
So the negative COVID cases, you still have to do the phone contact?
we still call them and let them know that they're negative. And we had been doing that through the entire month of June. As of July, we're not required to necessarily do that, and it's getting to be a bit much on the 2 or 3 people that we have working on it downstairs. So doctors' offices do call, but we do sort through them to make sure that they're all negative. We have to check all those lab results, things like that. Every positive, we have a full case investigation. And then, like I said, every positive, we go through and we do all of their contacts. So, and then we monitor all of those contacts. So it's very time intensive.
Then I'm sure it takes the time to get that all in the computer.
It's a challenge. Yeah. So right now, like I said, we hired a college student. So Madeline Rohr started with us last week, and that is what she does. She sits and she sorts through those and then makes us aware of the positives and the negatives. And she's putting a lot of those into our database for us and things like that, just to free up a little bit of time so that we can get a couple other things done as well. Any questions on anything that was reported as far as conferences, meetings, and activities? A lot of them are COVID related because that's what we do a lot of right now.
I think I asked this last month, Cindy, in regards to what we've been seeing in domestic and violence intervention, that sort of thing. Is that trending any particular way at this time?
We're not aware of any trends really here. I'm in pretty regular contact with VIP, and they have not expressed that to me at this point.
That's good.
Yeah.
I have a question on the
Yep.
virtual, the cooking class at Algonquin.
Yeah.
I mean, I know a lot of homes do not do home
Mm-hmm.
studios and all that. Is that typical in Algonquin?
It is not, and the reason being that the students have received Chromebooks through their school district. So they had it for the school year, which allowed us to do some virtual teaching that way. And then for the kids that needed it for the summer classes, they could keep their Chromebook for the summer. So they did have that available to them. We found that some of them didn't necessarily have all the ingredients at their house, which typically when we do our summer school, we're bringing them into a classroom and we provide everything for them. So we worked closely with the Algoma School District on that to make sure that the kids had the ingredients. If they did not, we were notified and we went out and got those for them so that they could take part in the class. We also gave each student that took part in it, part of it is learning some cutlery skills and some cutting and things like that in a safe manner. So we provided them with the silicone knives, which are a little bit safer for the kids to use at home. The class went for 3 full weeks, and it was 3rd grade through 8th grade could take part in it. So it was a wide range of wide range of students, but they really enjoyed it. So yeah, we were hoping to do some of our summer school stuff and got a little bit in.
You hear all the negative things. But
Right.
I think something like
Yeah.
that is positive.
Mm-hmm.
Correct. Thanks.
And the the walking, have you been getting a good turnout?
We have been. I can just kind of roll through what we have been doing. So we're trying to continue with our wellness programs, and in doing so, we've been doing some trail walks and trying to promote some of the county parks a little bit. So the girls have been meeting out around 9:30 in the morning on different trails throughout the county. So they have had participation in that. In addition, we offer some wellness classes after work on Thursdays here in the I don't want to say the parking lot, off to the side of the parking lot, and those have been attended as well. And people are just we're trying to get them to think of something else, obviously, and get some physical activity in there and some fresh air, and so those have been well received. Yes. And we're hoping to continue to do a little bit more summer school, but some of our schools have not started their summer school yet, so we're kind of on the fence with Luxembourg Casco. We have the offer out there to help out. Their summer school is running, I think, the last week of July, first 2 weeks of August. They're doing it much later than typically expected. So we're hoping to get a few more in. We are still planning our back to school program. As of right now, we're hoping to do it in person. We're trying to spread that day out as much as possible, encourage masking at it. It's going to be set up a little bit different. We typically offered every student not just their backpack and school supplies, but we were able to give them shoes, and the shoes will not be available this year. Hygiene products, though, will be. So we're waiting kind of to see on the numbers, and we've got two different plans going. One would be our typical day where they come in and they're able to pick out all of their supplies. We're hoping that that's the plan that we can go with, but if we see that those numbers continue to go up or we see some spikes going on, we may have to do more of a drive-through type of situation. But either way, we will have those school supplies ready for the kids, and that's going to be taking part in place in August. We have touch base with the schools. They're hoping to go through with their fall flu clinics with all their hearing and vision. So they are planning on doing things as close to normal as possible as we can move forward. And just so you're aware, the schools got money. I think it was last week it came out to buy PPE. I think the government's giving them the PPE. So they will be getting masks and different things for all of the students there. I know we had someone ask us if we're going to be providing masks with our back to school program, but that is being given to the school in their own pot of what the government's sending out. And we have been dealing with some health hazards, which is typical this time of year, but I don't know how many of you are familiar with the Alaska Motor Inn, but we had some issues out there in the month of July and worked with the sheriff's department to correct them. So the building was found to be a human health hazard. They were called out there on a 911 hang up, and it was in pretty rough shape. And there was people living in there that did not necessarily have the proper permission to do so. So we worked with the sheriff's department and went through the building and then notified the people that were there. We gave them adequate time to find alternative housing. I had notified the owner of the property. He was not aware of all of the people that were living there, but he had sent an eviction notice to the person that he had rented the property to, who was then illegally subletting it out. So it was an interesting situation, but I think as of last week, that was all cleared up. So I think that we made at least a positive move forward in that
Was
regard.
that building now condemned?
It is placarded at this point, yes. And they have a buyer that's interested in it. So I've also been contacted by the buyer, and my understanding is someone is hoping to purchase the property and possibly turn it into condos or something like that right there. So yeah, there was a lot of water damage to the building. So I don't know if anyone's familiar with how the layout used to be there, but there was a pool in the back, and the roof over the pool had collapsed. And so it was it was sort of covered by a tarp that was not really in place any longer. And so significant water damage with the heavy rains that we've been receiving was there, and significant mold was found throughout the building. Carpets were sloshing when we were walking through there. There's a fair amount of exposed wiring and broken glass throughout the building, and we had some kids that were living in there as well. So there was just a lot of red flags that went up. It was not an environment suitable for children by any means. I didn't think it was an environment suitable for adults. They had some squatters that were found in various rooms throughout there. So it was a situation. It involved multiple agencies, so law enforcement and child protective services and health department and various people were out there. And
It's kind of sad. It was a very nice historical
Yeah.
place at one time.
so hopefully they can turn it around.
Fortunately, we got in there, or you got in there before it actually, hopefully, anyone was harmed.
And hopefully, yes. Although I know that they've had a number of, 911 calls for various reasons out there. There's been drug issues and on the property and different things, and it just was not a desirable situation by any means. All right. I think that's all I have for you on agency updates right now.
Okay. So let's go to department updates. Or you were on agency financial report.
Financial reports. I gave you May and June, and I'm not sure if you got May last month or not. I was thinking that it came out just after we had met, but everything is in line on here. So the new grants that we've received are listed on these now, but we're still spending down our original grants. We're on track with our spending right now. We have closed out children and youth with special health care needs, as well as our original FEP grant, which is our preparedness program that ended in June as well. So we've closed out 2 for the year, and we have a couple more coming up in August that will end on that fiscal record. Does anyone have any questions for those? I'm hoping to get these out to you sooner. Unfortunately, though, they tend to come out a day or two before our meeting.
Well, I think too with COVID, it was a little understandable. So, yeah. Okay. Any questions, anyone?
And for the most part, what you're probably going to see is that our county tax levy budget will be less utilized this year. Due to the contact tracing and things that are going on, we're not spending the dollars in the county tax levy as we normally would because we've received that additional funding because of COVID. Yeah. If that makes sense.
Any other questions, Cindy? Anything? We'll move to travel request.
I have none.
Nothing. Overtime.
We're still doing minimal amounts of overtime. I handle most of the on-call hours over the weekend. I did take off this last weekend, which was kind of nice. So Allie covered for me. So we're averaging probably less than 12 hours of overtime a month right now.
And next meeting, which we have one down.
Is there any chance we could change the August one? I have a conflict with that. And I'm wondering if we could go like a week earlier or a week later.
Okay, August 10th, we want to take off. You want to do the 3rd, Cindy?
That works great for me if we could.
And what I'll do is we'll check with Beth to make
Yep.
sure so we can piggyback both of them. So we're going to do 8:30 on August 3rd. Is that okay with everyone? If we move it from the 10th to the 3rd. Okay, Linda, Jeff, Milty, Virginia. Okay, we're good. Pastor? I know, but I just check. You're here. Yep, at 6 o'clock. Right. Okay. You're good. And ladies over here, Kathy, Julie, we're good? Okay. Then we're going to go to September. And because of Labor Day, the 14th, which it would fall. Is that okay for everybody? The 14th, Monday the 14th, 8:30?
As of now, yes.
Okay, Cindy?
Mhm.
We're good?
Yep.
And then we'll check with Bets. Otherwise, if you don't hear back from me, we're just going to say everything should be good. Okay?
Awesome.
Okay, perfect. Everyone good with that? And any other matter? Otherwise, do I have a motion to adjourn?
I'll move.
Virginia? Second? Milty? All in favor?
Aye.
Aye. Oppose? We're adjourned.